I posted a video about how I was choosing to go to China to do some diagnostic tests instead of going through the NHS, and I had so many comments and so many questions, and normally you'd be like a little bit excited to have a video go really popular, but there was hundreds of comments from people sharing their own stories about failures within the NHS and how people have been waiting for months, people are being diagnosed too late. It's been really eye-opening, I've got to say. I'm really shocked and a little bit disappointed that so many people have resonated with the video that I put. But there were like loads of questions, and I do just want to like boom go through some questions. I'm actually flying to China tomorrow, so I will have a lot more questions answered for you once I'm actually in China. But the first thing is, why China of all places? So I just want to like preface that I used to live in China. I used to work there, I used to study there, and I'm really familiar with China. I've always found that the Chinese medical healthcare is much more proactive in trying to find something before you even get a symptom, rather than the NHS, which is reactive, which reacts to symptoms that you already have. So for example, in China, it is absolutely normal and standard for every single person to do an annual health check. It's almost like an MOT. You just go and you pay, right? But it's not expensive, it's affordable for Chinese people. You go for one day and you run through all the tests of the day, blood tests, scans, everything. In fact, I actually got a list: height, weight, BMI, blood pressure, ECG, blood tests, urine analysis, abdominal ultrasounds, chest x-ray, breast ultrasound for women, and prostate ultrasound for men once a year, vision and hearing tests, dental screening, gynecological exams, tumor markers, and then you can also get like bigger packages, and then that goes through like colonoscopy, cardiac ultrasounds, hormone panels, full body MRIs, all of that stuff. It's not unusual. Like, this is absolutely normal in Chinese culture to do an annual health check once a year. Just to think how many things would have been found by this proactive nature of the Chinese medical healthcare system. How many things have been found before you even feel a symptom? Whereas in the NHS, if I wanted to go to my GP and say, hey, I'd just like to do a general health check to make sure that everything's ticking along nicely, you'd get laughed out of the room, wouldn't you? I find that we're always a little bit on the back foot with the NHS because you have to be showing symptoms. And so once you're showing symptoms, sometimes you're already too late, if that makes any sense. So that's just like a little bit on why China, because I found that the system is really, really efficient, really, really affordable. Not just affordable for me as a Brit, but affordable for Chinese people in China as well. And things are just very, very fast. Obviously, I'm also familiar with it. I'm married to a Chinese woman, like all of these things too. Second question, how much is it gonna cost? I don't know yet because I haven't obviously been, but I will make a tally of everything that I'm paying for. I'm expecting all of my diagnostic stuff and specialist consultations to go to around 350 to 600 pounds in total. But then it really depends, right? It really depends, what do they find, what sort of treatment might I need. I'll be really transparent, but I don't know yet because I haven't gone yet. There was another question, why don't I just go private in the UK? Again, cost. Private is super expensive in the UK, and not even that quick. I have to say, I have done private before in the past, and I'm not getting really fast service there either for the cost, you know, like for the cost, for the thousands and thousands of pounds that you're paying. Like, in comparison, the camera down the throat in the UK is like between £3,000 and £4,000, whereas in China it's £300 to £400, and I'm going to be fully sedated during that as well. I can choose that as an option. So that's why I haven't gone private in the UK. The last question was, what will I do when I come back to the UK? Will I bring that treatment plan back to the UK and expect the NHS to do that for me? And the answer is no, not really. Possibly the NHS wouldn't accept those results. Possibly they would though, because when I've gone private and then that doctor wrote a letter back to the NHS, my records were updated. But I'm hoping to do all of my treatment and everything in China if possible. Obviously, if there's anything really bad, and everything crossed, yeah, everything crossed, but if there is something really bad, and then that means long-term treatment, chemotherapy, you know, like that's I don't want to even think about that, but just imagine, then I'd have to rethink, and I have to rethink. If there's a very, very, very long-term treatment plan, I'll probably need to come back to the UK. But at least with a diagnosis, at least with those results, I can push my GP in the direction I need them to go. So I think we'll just see, but I am planning to do all my treatment as well in China. So I'll be really, really transparent as much as I can, and I haven't shared the hospital I'm going to just from a security perspective, because I'm flying tomorrow and then I've got my appointment the day after. But as soon as I finished all of that stuff, I'll be really transparent about exactly where I went and how I found it and things like that. The consultation only cost £6 for a specialized consultant doctor in gastro stuff, so that's a really good sign. And yeah, I'll keep you guys updated. Okay, need to pack.